Welcome to Eco Family News on I'm Healthy Radio. I'm your host, Kathy Arnos, and want to thank you for joining us. Eco Family News is a news resource of Whole Children, Whole Planet, whose primary purpose is to introduce and educate people about the benefits of natural products, organic food, sustainable living practices, holistic medicine, enrichment learning programs, and important health and environmental issues for protecting our children, ourselves, and the planet. We want to provide people with the tools necessary to make informed, educated decisions and to inspire you to take action, as each of us can make a difference. For more information about Eco Family News and Whole Children, Whole Planet, please visit www.ecofamilynews.com. Our first guest today is Dr. Jay Gordon. Dr. Gordon has been in private practice in Santa Monica, California for 25 years. He is a fellow of the American Academy of Pediatrics and is an associate clinical professor of pediatrics at UCLA School of Medicine. He is a frequent medical commentator and media resource on pediatric issues, appearing on television shows such as Good Morning America. He has a DVD titled Vaccinations: Assessing the Risks and Benefits. He is the author of several books, including the co-author of the newly released The ADD and ADHD Cure, The Natural Way to Treat Hyperactivity and Refocus Your Child. Dr. Gordon is passionate, outspoken, and takes a controversial stance when it comes to the subject of vaccines. He has a sympathetic ear to parents' concerns about possible adverse side effects and frequently is asked to respond to such issues on the popular Huffington Post blog. Dr. Gordon has a senior fellowship in pediatric nutrition and is on the advisory board of Whole Children, Whole Planet, and La Leche League International. His website is www.drjaygordon.com. That's DRJAYGORDON.com. Good morning, Dr. Gordon. Thank you for joining us.
Good morning, Kathy.
We all know that the decision to vaccinate really isn't an easy one. It's like really complex and very confusing for many families. In your DVD, you state that this is a decision that should be made by a patient or parent in consultation with their healthcare provider, and also in alignment with their own conscience. A good doctor is one that's willing to have a conversation about vaccines and honor your feelings and wishes. I think that's really great advice. So, what do you believe is the best plan of action for a family faced with the vaccination decision?
Well, the first thing is to get as educated as possible about vaccines so that when you make the decision, you're making it based on the facts that you gather from sources that you trust, and then evaluate your own family situation, your travel, any unusual family risk factors, and talk a lot with a doctor that you trust. Most pediatricians and most healthcare practitioners truly believe that the way we vaccinate now is the best way. It's best for public health and for kids. I personally feel that we're not vaccinating based on enough science.
Yeah, well, and there are a lot of factors involved too, because there are a lot of contraindications for people to receive the vaccines.
Well, in my mind, and maybe in your mind, there are a lot of contraindications, but officially, there aren't a lot of contraindications. In other words, if I'm talking with a family with a lot of autoimmune problems, diabetes, arthritis, or autism, which I regard as a neuroimmune phenomenon, I think that that's a contraindication to vaccinating. I think if a child has unproven neurological stability, if they've had a seizure, or if they are very young, I think that's a contraindication to vaccination. But the American Academy of Pediatrics, the CDC, the ACIP, the American Committee on Immunization Practices, do not recognize those as contraindications at all.
Oh, boy, that's really sad.
I think so.
Yeah, I know that, when my daughter was little, she's, 24 now, but when she was young and she had reactions to vaccines, I didn't even realize that there was a little insert that came in the vaccine packet that, that we don't usually see, that talks about different indications, and that would be, is seizures still on that list?
No.
It isn't?
No, to the best of my knowledge, it's a huge package insert. It's only about, I think it's about 2 or 3 inches wide, but when you unfurl it, it's almost like you're in a cartoon because it unfurls to be a few feet long. And the fine print is blinding, and I guarantee that most doctors have never read that package insert. But in the contraindications, I don't even know what they list as contraindications. An allergy to one of the constituents of the vaccine is listed. If you're allergic to eggs, you have to question whether or not you can get a chickenpox vaccine. But for the most part, unless you've had a major adverse reaction to vaccination, they're not contraindicated. And I really think they're wrong. I think that if we vaccinated much more slowly, and if we vaccinated one vaccine at a time, and we waited until a child were much older, we'd gain more parents' confidence. I personally am very comfortable with deviating from vaccine schedules, but most doctors are not, and they push the parents pretty hard.
Yeah, well, that's what I hear a lot too. So how does one really assess the risks and benefits for each vaccine?
Well, the way I assess it, again, is different than the way a lot of other people assess it. The way I assess it is unless there are unusual risk factors, a child can wait a long time for vaccination. I think that the herd immunity is very protective of members of the herd who vaccinate late. I think that we have a fair number of vaccines which work very well, but we underestimate the risks. This remains the only area of medicine where we deny side effects. In any other area of medicine, if you're getting antibiotics for a urinary tract infection, we have to talk to you about the diarrhea and the rashes and the yeast infections that most women get. And apologize for those side effects. But when we give vaccines, when we give 5 vaccines or 6 vaccines to a little 12-pound, 6-week-old, we tell you that even though you've heard about seizures and you've heard about autism and so on, these are all coincidences. They're not all coincidences. There are side effects. Some of the side effects have actually been acknowledged in the vaccine court and in a court of law. Most of the time, vaccines have been found innocent of causing autism. But there have been cases where the plaintiffs, the parents who allege that their child was injured by vaccines, have won. And I think that there are going to be a lot more of these cases. I think that just as we had a lot of trouble bringing the tobacco manufacturers to task for creating a product which really wasn't proven and didn't have the risk-benefit ratio that they claimed it did, I think that vaccines causing autism will be a long set. Well, there'll be a lot of court cases that are going to have to be fought before we actually show that there can be some harm. I don't think that all children with autism developed autism because of vaccinations, and I certainly don't think that every child who gets vaccinations is harmed. But I think that there are a fair number of kids who suffer adverse effects from vaccinations, and that if we looked a lot harder, we would have fewer of these problems.
And do you believe that children are safe with or without vaccines?
I think that an individual child is very safe without vaccination. I think a lot of this has to do with herd immunity. But I also think that if we allow the immune system to develop naturally, children are healthier and will... I think the children are healthier without vaccines, quite frankly. But I also understand that can't be national health care policy right now, nor can it be global health care policy. I don't want to stop vaccinating against polio in Africa. And for that matter, I don't want to abandon the DPT program in the United States, because even though I don't think that we'd have the return of polio in America, I think that if we stopped giving DPTs, we would get rolling whooping cough outbreaks from hell, and people would remember why we have that shot. I just think it should be given later, slower. It should not be given in combination with 5 other shots. I think the parents have the right to refuse it and accept the possibility, the increased possibility of whooping cough in an unvaccinated child. I think that there are liars on each side of the issue. I think that people who claim that vaccines don't work and they cause autism anyway, and measles was going away before the vaccine anyway, I think this isn't honest. I think that the reason we have virtually no measles in America and that a blip of 134 cases can cause newspaper stories for months on end. The reason is that the vaccine works well. But now that we're averaging 35, 50, 60 cases of measles a year in America, I think that parents have the right to look harder at whether or not they want their child vaccinated according to the usual schedule.
Right. Well, I know my daughter had been vaccinated age appropriately and had a collapsed shock syndrome reaction to her 18-month vaccination. And then she also had whooping cough a couple of times, twice. So it was interesting. It was kind of a strange dynamics of what happened to her, and I know that she wasn't the norm. You know, she had a much weaker immune system, and we don't know whether or not that was due to the vaccine or that's why she had so many problems. So, you know, we'll never know that truth. But you also bring up a good point, and that's about the false reporting of epidemics. Do you want to go into that a little bit?
Firstly, 20-some years ago, we had a relatively ineffective vaccine, DPT vaccination, and there was also, medically speaking, a dirty vaccine. Mm-hmm. The new one is much more effective and much cleaner, but what you're describing occurred a pretty fair number of times back then, where kids not only had reactions to the vaccine, but they also got whooping cough later. Mm-hmm. And right now, that's the vaccine that I give most readily, the DPT, because I think that protection against whooping cough is practical, even though I think that you can get by without it. And protection against tetanus is very comforting to most parents. Mm-hmm. I just would love to wait and give it later rather than at 6 weeks of age, and I'd love to not give it in combination with other vaccines. And again, I support a parent's decision to not vaccinate. I think that public health factors into the equation both in my mind and in the parents' minds, and then they make a very personal choice about their own family.
Mm-hmm. Yes. So in terms of like false reporting, I know that in your DVD too you also talk about the polio cases among the Amish.
Oh, well, there were the first thing you mentioned, the pertussis epidemics. I mean, there's a wonderful story in New York Times from a year or two ago about the epidemic that wasn't at Dartmouth University Medical School, where they used a preliminary test to diagnose quite a few cases of whooping cough and to treat, I believe, thousands of people, and then they found out that there were no cases of whooping cough because the preliminary tests aren't good enough. As far as the polio outbreak, the children in Minnesota, a child in Minnesota was hospitalized for what was later diagnosed as a combined immunodeficiency disease and was found to have polio antibodies. In fact, what had happened was that he had been exposed to someone who had received the oral polio vaccine, which is the vaccine we used to give here and which they still give in most parts of the planet. And that vaccine can transmit immunity, in which case you detect antibodies. Mm-hmm. So if you read the story completely, what it says is that there were no signs or symptoms of polio because there wasn't polio. There were just antibodies against the vaccine. And it's that kind of reporting which doesn't serve either side very well. There was an article in January or February of 2009 talking about measles in 2008. And what they said was that instead of the average 62 cases, in 2008, in the first half of the year, there were 131 cases, in the first half of the year alone. And then if you had asked, or if the reporter had been honest, we could have asked, how many cases were there in the second half of 2008? And the answer was 3. So it was a piece of journalism that was calculated to try to scare people. And when either side tries to scare people, when the so-called anti-vaccine side tries to convince people that vaccines, that your child is at great risk of autism from vaccines, they're not being honest. Mm-hmm. I think that if there's a genetic predisposition to autism, maybe to diabetes, maybe to other diseases, I think that vaccines can trigger this genetic predisposition. The proof isn't there. I don't know about you, but I'm constantly challenged to produce science. I don't have a great deal of science. I think that there are some decent studies showing harm from vaccines, but I think we need a lot more research before anybody can really claim that vaccines cause autoimmune diseases or autism. But there's enough evidence so that we should really hesitate before we give those 5 or 6 shots, those 5 or 6 vaccines all at the same time.
Well, do you really think they've taken the mercury out of the vaccines, the thimerosal?
Thimerosal has been removed from most vaccines. It's still found in a lot of flu shots. It's found in many tetanus vaccines, tetanus boosters. It's found in the Japanese encephalitis vaccination, which nobody listening to us probably has to worry about. But most of the mercury is gone. The aluminum is still there, though. Aluminum is a fairly toxic metal. Mm-hmm. Again, no proof that it causes great harm, but lots of studies showing that it's not good for you to be injected with lots of aluminum. And the great Bob Sears has written an excellent book with an aluminum essay where he said that if you happen to get the wrong combination of shots from the wrong manufacturers at 6 weeks of age, you get a huge overdose of aluminum. I don't remember the number that he uses, whether it's 10, 20, or 100 times more aluminum than you're supposed to get. But it's not an accidental, 120% overdose. It's hundreds of percent. Bob Sears' book details how unpleasant it is to have to add up the amount of mercury in a set of shots.
Mm-hmm. Well,
and unless you do the math, you don't realize how bad it is.
Right. Well, it's interesting. I don't have any, I can't cite any studies or anything, but I have heard that that there is a possible connection between Alzheimer's and aluminum, and there are lots of different things running around out there, if you will, little articles that say this and that, and I too like to see studies. But, there was a time, back when I first was investigating vaccinations, and I was doing a lecture and I did some research. I called, the immunization division of CDC, and they had told me during that particular year that they had 60 cases of pertussis and there were no fatalities that year. And then I saw this article that stated 1 in 1,700 people who received a vaccination would have an adverse reaction, and that 1 in 60 children would have an adverse reaction to the actual disease. So when I started looking at those numbers, I thought, well, since tens of thousands of kids get vaccinated every day, you have this high rate of possibility of an adverse reaction, and when there were only 60 cases of pertussis reported for that whole year, that meant that only one could, there was the possibility of one of those children having an adverse reaction to the disease. So when I started looking at those numbers, I was going, wow, that's really interesting and doesn't really make sense when they're putting it in those contexts.
I think that usually there are a lot more cases of pertussis. I'm not sure exactly what they were reporting, but my reading shows that there are thousands of cases of pertussis with very few complications. A lot of the data that they use were gathered decades and decades ago when we didn't have adequate pediatric care, where if you did get a complicated case of measles pneumonia, we might not have any support for you.
Right.
And that's not the case anymore. I mean, I don't wish measles complications on anybody, but if you get measles complications in the year 2009, we can treat you.
Right.
There are certainly complications from all diseases, including routine colds and coughs, that are very difficult to treat. Every time there's a good flu season, there are thousands of deaths associated with influenza. But to rely on data from the 40s, 50s, and 60s for treating kids in the 21st century it's not good journalism. It's not fair medicine either.
Yeah, and I just want to clarify that was back in the early 90s that
Mm-hmm.
I had gotten that count of 60 from CDC.
Geez,
So
that's pretty low.
yeah, yeah, that's what I
I'm not
thought
sure.
at the time.
I'm not sure exactly to what they're referring, but I do see whooping cough. I mean, I've seen whooping cough in the past couple of years in my practice,
Yeah.
and it's a very nasty illness. It's a long, drawn out illness. I've not hospitalized a child for whooping cough for at least 10 or 12 years. I think I hospitalized one child in the 90s and another child in the 1980s, and it's not common to see kids have trouble with whooping cough. It is again, it's a nasty, disruptive illness. I don't wish it on anybody. I would love to have an opportunity to give kids just a pertussis vaccine without any diphtheria, without any tetanus component, but that's not offered. I don't have a single dose pertussis vaccination. No additives, no preservatives. They don't make it.
Right. Well,
So
in terms of, you were saying in terms of like flu vaccines and stuff, are you familiar with the Senate passing a martial law bill in Massachusetts earlier this month?
not that familiar.
Okay. Well, I was just curious. There's talk of a possibility of mass mandatory vaccination of this new
Hmm.
experimental swine flu vaccine. So I was just curious.
Not likely. And I think that in terms of political coalitions, this is a strong coalition. There, there's a right wing and a left wing and a libertarian. There's an awful lot of people who would oppose mandatory vaccines, and I don't think anybody in their right mind would really try to ramrod that through the United States Congress, because it's a little bit too
Radical.
fascist. Well, I was thinking fascist. Thank you. I wasn't going with radical. I was going with fascist. It's not going to happen. I mean, I'm bothered by the fact that parents have so much trouble with school systems and with camps and with other parents because they choose to not vaccinate, or to vaccinate late, or to partially vaccinate. I understand the public health implications, and I don't want a big microphone. I don't want to be on a radio show, yours or anybody else's, telling people that vaccines stink and they don't even work, because it's not true. Vaccines don't stink, and they do work. The way we give vaccines is
Yeah.
not good. The claim that vaccines always work, or that's the only way, that's not honest either.
So
If someone has the facts, they can make decisions.
So, yeah, let's talk about the immune system overall. I mean, our bodies are pretty powerful entities.
Yes.
And I think that, again, on your DVD, you talk about immunities and what immunities would you like your child to get naturally. Give me a little on that.
I think that if children are left alone, they develop immunity to common viruses and common bacteria. I think that when we start fooling the immune system, tweaking it, changing it irretrievably at age 6 weeks, actually at birth, we give a hepatitis B vaccination within hours of birth. When we start making those changes, I don't think we really know all the ramifications. I don't know if it's mildly dangerous or very dangerous. I'm not sure. All I can tell you is that it's not as safe as the manufacturers and their researchers claim it is. And I would love to see people step back and start vaccinating slower and start gathering more data, rather than being so concerned with scaring people into getting all the vaccines right away.
And where do you suggest parents go to find those resources? Do you have any favorite fact places that they can go to and check?
I suggest that they check all the conventional, at least one conventional source, the American Academy of Pediatrics books, and so on. But then from there, I recommend that they buy Stephanie Cave's book and Robert Sears' book and Randy Neustadter's book. These are three authors who've taken a really nice alternative view of vaccinating. And they're very much worth reading.
Well, the first book that I ever read was DPT, A Shot in the Dark by Barbara Lowe Fisher.
Another very good book. Again, I don't know if it's out of date. I haven't read it in a long time. And quite frankly, she only presents one point of view. I mean, the reason that I like Stephanie Cave's book and Bob Sears' book is that they're willing to look at the benefits of vaccination, the drawbacks to abandoning the schedule. They suggest alternative schedule. People are constantly asking me for a tailor-made or an alternative schedule for vaccinations, and I don't have one. That's kind of a little bit oxymoronic for me to suggest an alternative schedule. Each individual family, I think, has the right to do this. And I'll tell you that my experience recently is that the established the powers that be, whether it's the CDC or the internet scientists or researchers, that are more uncomfortable and dislike selective vaccination even more than they seem to dislike anti-vaccination. And they seem to be saying things like, who are you parents, to make decisions when not only are you not infectious disease specialists, you're not even doctors. Who are you to challenge us? And my answer is, they're the child's parents. They're entitled to have a lot of input regarding medical care. I can't believe that there are people, and that it's really recent too, people who are saying we don't need any further study. No more studies should be done. What an unscientific point of view to say that we don't need any more studies of the connection between vaccines and harm from vaccines. Yeah. It's just absurd. We should be putting a lot of resources into studying this. At the same time, we're so grossly underfunding treatment of autism that there's a whole wing of the autism community that dislikes the vaccine ambivalent doctors. They say that we're diverting resources from the treatment of autism. Actually, there should be government funding and industry funding for all of it. I was on a television show some months ago where we were discussing autism with a family who have 3 children with autism and 4 without, and have an 8th child on the way. And I was going to appear as an autism expert, which, by the way, I'm not. And they said, we know that you're going to want to talk about vaccines. And I said, no, I don't want to. They said, well, we know you're going to want to talk about vaccines, so we're bringing on an opposing expert. I said, I don't need to talk about vaccines. What I'd love to talk about is autism, the lack of respect from the medical community, the lack of respect from the insurance industry, the lack of respect from the government, the fact that people are so strongly discouraged from looking at innovative treatments for autism after everything else has failed. That's what I'd like to talk about. I don't want to sit for an hour on television and debate with another doctor whether or not vaccines can cause autism. Because as far as I'm concerned, you can't, as they say, you can't prove a negative. You can't prove that vaccines don't cause autism.
Right.
You can't prove that there's no harm from vaccination. What you can show is that there may be other factors, or that it's unlikely that most cases of autism are caused by vaccination. You can do that. But I'm quite frankly really tired of debating that with people who are as closed-minded as they accuse me of being. I'm open-minded about this. Do a good study,
right?
And I'll reconsider. But don't base this on 3 court cases or 8 pieces of research that were funded by the industry showing that there's no connection. That's just, again, terrible science.
Right. And you have a new book out called The ADD and ADHD Cure, the natural
Yes.
way to treat hyperactivity.
Yes,
and
a hyperbolic
refocus.
title for a hyperactivity book. What it is a book that talks about how if your child or people in your family have a tendency to attention deficit disorder, there are ways of minimizing the tendency and avoiding medication for attention deficit disorder. And even if you end up with medication for attention deficit disorder, there are ways of keeping the dose lower and minimizing the side effects. And it's a book that I would love everybody with ADD children to read. And if you don't read it, just know that mostly what it says is stop giving your kids so much sugar.
Absolutely.
Buy the book if you want to, though.
You're a man after my own heart.
Thank you.
It's the sugar and the dairy.
It's the sugar and the dairy and the colors and the preservatives.
Yep.
And the lack of exercise and the lack of sleep and a school system which has been shocked by the number of kids with problems. You know, the CDC estimates that 1 out of 6 children have issues: attention deficit disorder, dyslexia, autism, OCD, and so on. I was at a meeting of doctors and scientists who were discussing autism, and one of the people there was a very straight-arrow researcher who also had a private practice in pediatrics. And he said to me privately, he said, I vaccinate every single child in my practice on schedule. And I said to him, what are you doing here? And what he said to me kind of chilled me a little bit. He said, something's wrong, and I want to look at all the data. But he said to me, something's wrong. And I know just what he means.
Yeah.
I've been doing this for 30 years. I didn't see it. I mean, if you look at, you can read, and again, this is from rather biased websites, but if you talk to doctors, they'll tell you that when we were in training, again, 15, 20, 25, 30 years ago, if there were a child with autism on the ward or in a clinic, the professor would pull in all the interns and medical students and say, you've got to see this kid because you may never see this again. This child has autism. Well, now I sometimes see kids with autism 3-4 times a day.
Yeah. Yeah. I mean, when I go out in public, I meet children with autism all day long.
So this isn't a coincidence, and we're not hundreds of % better at diagnosing this, and it's not because we've reclassified diagnoses. Something's wrong.
Yeah.
It might have to do with plastic water bottles, plus vaccines, plus flame retardants, plus other chemicals.
And pesticides and herbicides and the whole gamut.
Absolutely.
Yeah.
I believe it has something to do with vaccinations, but it may be proven that it has very little or nothing to do with vaccines, but it's all the other chemicals. And if we discard all of this research, or if we claim that we're diverting too much money to looking at autism and vaccines, or that parents shouldn't be wasting their money on alternative treatments, then show more respect for the parents. Believe the parents.
Right.
Believe the parents. That's a big deal.
Yeah, they know their children, and they
Yep.
know where the changes took place, and they know their kids better than anybody else.
There you go. I think that's the motto at the top of my website.
Yeah.
Nobody knows your child better than you do.
Exactly.
And boy, the so-called scientists online hate that.
Well,
And nobody, you know whether or not your child is going to, you know your child better than any doctor will ever know the child.
exactly. Well, I really want to thank you for joining us today.
You are welcome. A pleasure.
You've been listening to Dr. Jay Gordon, pediatrician, author, and expert on the subject of vaccines. For more information about Dr. Gordon or his books and DVD about vaccines, please visit www.drjaygordon.com. That's DRJAYGORDON.com. I'm your host, Kathy Arnos. You've been listening to Eco Family News, and we'll be back after a short break with our next guest, Barbara Lowe Fisher. co-founder of the National Vaccine Information Center and author of the groundbreaking book DPT: A Shot in the Dark.